Hello, my name's Melissa, a third-year medical student, and today I'm going to be reading High-Yield Anatomy Facts for USMLE by Dr. Goljan. Dye that passes from one cell to the next is a gap junction. The adrenal medulla has a neural crest origin. Neuroblasts develop into ganglia. You should know the layers of the adrenal gland from outside in: cortex, glomerulosa, fasciculata, reticularis, medulla. The function of the tibial nerve is plantar flexion of the toes. Injury results in loss of plantar flexion. The foot is dorsiflexed, everted, and there is sensory loss on the sole of the foot. The aortic and the pulmonic valve are lined by endothelium and have abundant fibroelastic tissue plus a dense collagenous core. They are both avascular. The mitral valve and the tricuspid valve have a loose connective tissue core, which is increased in mitral and tricuspid valve prolapse, known as myxomatous degeneration. Breaks in the humerus cause radial nerve injury, which results in wrist drop. Paralysis of the serratus anterior muscle occurs after radical mastectomy, presents as a winged scapula due to injury to the long thoracic nerve. A patient with a nosebleed and rhinorrhea has a fracture of the cribriform plate in the ethmoid sinus. Internuclear ophthalmoplegia in multiple sclerosis is due to demyelination of the medial longitudinal fasciculus. The parathyroid is derived from the third and fourth pharyngeal pouches. The phases of eggs before meiosis I is arrested in prophase until ovulation, and meiosis II is arrested in metaphase after fertilization. The median nerve runs along the radial artery. The artery affected in femoral neck fractures is the medial femoral circumflex artery. Sperm penetrates the zona pellucida of eggs. Metaphase II is completed in the uterus. Meiosis I is arrested in prophase, postpartum. Stage of eggs postpartum. Meiosis I is arrested in prophase. Collagen I is present in bone, tendon, and skin, has the greatest tensile strength. Collagen type 2 is the initial collagen of wound repair. It is replaced by type 1. Type 4 collagen is present in basement membranes. Type 10 collagen is present in the epiphyseal plate. Wallerian degeneration occurs when Schwann cells begin to proliferate and form a tube that will serve to guide axon sprouts in the regeneration process. Regeneration of the nerve occurs by the outgrowth of multiple axon sprouts from the proximal surviving segment of the axon. Sprouts are directed distally at a growth rate of 1 to 3 millimeters per day down the tube established by the proliferating Schwann cells. Sprouts are remyelinated and reestablish continuity with the motor end plate of the muscle. Know the arteries in the circle of Willis. Know where the hepatic vein drains into the inferior vena cava on a liver CT. The nerve injured in a mid-shaft humeral fracture is the median nerve. Know the layers of the gastric mucosa. Oligodendrocytes myelate in the central nervous system, while Schwann cells myelinate in the peripheral nerve system. Ocular nerve palsy presents as an eye that cannot open and is deviated down and out. An eye that is deviated down and in is a trochlear nerve palsy. A child with a popsicle stick in his mouth falls down, causing the popsicle stick to hit the back of his throat, develops ptosis and meiosis of the right eye, is an injury to the cervical sympathetic ganglion. Vertical diplopia is associated with cranial nerve 4 palsies. Patient with headache and physical findings of mydriasis in the right eye in association with mild lid lag and deviation of the eye down and out has an aneurysm compressing cranial nerve 3. The headache is a giveaway for aneurysm. A patient with a recent history of bacterial meningitis who has horizontal diplopia in the left eye, which is worse on gaze to the left, has a cranial nerve 6 palsy, resulting in lateral rectus muscle weakness. Paralysis of upward gaze in an infant is hydrocephalus secondary to stenosis of the aqueduct of Sylvius, known as Perinaud syndrome. Multiple ocular motor nerve disorders. Patient has diabetes mellitus. Cranial nerve palsies are from osmotic drainage to the nerves. A patient with weakness of the quadricep muscles and an absent knee-jerk reflex has a herniated lumbar disc from L3 to L4. Patient with pain in the hip and lateral quadriceps, numbness of the anterolateral leg and the web space between the great toe, weakness of dorsiflexion of the foot, and a normal knee and ankle jerk reflex has a herniated disc between lumbars level L4 to L5. Herniations from L5 to S1 result in numbness along the lateral and posterior aspect of the calf and plantar aspect of the foot, and an absent ankle jerk reflex. A young child falls on an outstretched arm and has pain in the middle and lateral portion of his clavicle. The upper extremity remains in abduction, extension, and internal rotation. This child has injury to C5 to C6 known as Erb-Duchenne syndrome, or superior brachial plexus injury due to a clavicular fracture. These are also the most common fractures in newborns. Injury to C8 to T1 of the inferior brachial plexus is a Klumpke syndrome. A patient has paralysis of the ocular motor nerve after a head injury, has an uncal herniation with compression of the third nerve, resulting in ptosis of the eye and mydriasis. Numbness of the thenar aspect of the hand is injury to the median nerve, known as carpal tunnel syndrome. The wrist bone with the greatest incidence of aseptic necrosis is the navicular bone, also known as the scaphoid. Supracondylar fractures result in injury to the brachial artery in the median nerve. There's a danger of ischemic contractures in the forearm muscle, known as Volkmann's ischemic contracture. Know that in fetal circulation, the highest oxygen content are in the ductus venosus and the umbilical vein. Known electron micrography of the alveolus with a macrophage has a type 2 pneumocytes known as lamellar bodies that secrete surfactant. Know the electron micrograph of a small bowel with microvilli on the surface. On a histological section of seminiferous tubules, be able to identify the cell that makes the sex hormone binding globulin, the Sertoli cell. Know the bands in skeletal muscle, and that the A band has myosin ATPase. The last airway structure with cilia is the respiratory bronchiole. The terminal bronchioles have cilia, but no goblet cells. The terminal bronchioles are the site of obstruction in asthma, cystic fibrosis, and chronic bronchitis. Known electron micrograph of normal organelles in a cell. Know the normal structures on CT exams of the chest, the abdomen, leg, arm, and central nervous system. A patient that has hoarseness post-thyroid surgery has an injury to the laryngeal nerve. Know how to find the superior oblique muscle on an MRI of the orbit. Be able to identify the splenic artery above the pancreas on an abdomen MRI. Be able to identify fluid in the costophrenic sulcus in a patient with congestive heart failure on a chest x-ray. Know how to separate the small intestine from the large bowel on a barium study. Know that the superior mesenteric artery supplies the small bowel. A patient with mitral stenosis has an enlarged left atrium. Be able to identify this on an x-ray of the posterior heart. An MRI of the carotids with an occlusion in the anterior cerebral artery affects the contralateral leg. Schwannomas in the jugular foramen cause weakness of the palate, loss of gag reflex, laryngeal paralysis, paralysis of the trapezius and sternocleidomastoid, and loss of taste sensation in the posterior third of the tongue. A lesion of the oculomotor nerve with upper motor signs is Weber syndrome from a midline midbrain lesion. A Horner syndrome involves the cervical sympathetic ganglion be able to identify on a diagram of the vertebrae with the sympathetic trunk, be able to identify an oculomotor nerve lesion on a pupil light reflex diagram. The spinal cord in adults extends down to the second sacral vertebrae, be able to find the oculomotor nerve on a gross brainstem image, know that frontal lobe lesions affect personality. A lesion in the optic chiasm causes bitemporal hemianopsia, which is commonly a craniopharyngioma derived from Rathke's pouch in children. Defects in the superior fibers of the parietal lobe cause an inferior quadrantenanopia. A patient with a loss of sensation in the hands and history of burns without knowing it is a syringomelia in the cervical cord that involves the cross-spinothalamics. Know how to identify a C2 transection of the fasciculus gracilis, injury to which would affect vibration and fine touch of the lower extremity only. Cranial nerve 3 and upper motor signs on the opposite side is a midline midbrain lesion. Loss of pain and temperature and upper motor signs on the opposite side is a mid-pons lesion. Be able to identify the Horner syndrome with localization of a lesion on a diagram. Lateral medullary syndrome is associated with cranial nerve palsies in the medulla and the hypothalamus, which is associated with temperature regulation problems. Be able to identify neural crest cell tissue on a cross-section of an embryo. Know that blood production prior to birth occurs in the liver and the bone marrow. A Bachdalek hernia in the posterior lateral part of the diaphragm on the left presents early in life with visceral contents extending into the chest cavity, causing severe respiratory distress at birth. Parasternal diaphragmatic hernias extending through the foramen of Morgagni beneath the sternum do not usually develop symptoms until later in life. The artery associated with the foregut is celiac, with the midgut is superior mesenteric, with the hindgut is inferior mesenteric. A rock and roll band player with damaged hearing has injury to the cochlea. Know the normal histologic appearance of small bowel and stomach. A pupil that accommodates when the patient follows a finger moving towards the nose but does not react to direct light is an Argyll-Robertson pupil from neurosyphilis. A defect in the superior fibers in the parietal lobe causes an inferior quadrantenanopia. Quadrantenanopia.